So the thing to realize is that the way Ebola virus disease affects the body, because of the fluid losses and other things that can happen, acute kidney injury can be a complication. And when you have acute kidney injury that's severe, sometimes dialysis is required. So we know in the United States, 2 patients required dialysis in the setting of Ebola virus disease. And we know that in Germany, at least 1, and we think probably 2 patients have received renal replacement therapy or dialysis in the setting of Ebola virus disease. So in terms of managing the dialysis, there's 2 issues with that. There's managing the dialysis in an Ebola virus patient that may require some modifications of the dialysis procedure in terms of how you do it medically, but there's not much difference. Probably the main thing to consider is that Ebola virus disease does cause a hemorrhagic type picture, and so certain anticoagulations like systemic heparin that we use for anticoagulation and dialysis wouldn't be recommended in that setting. But overall, the modification to the dialysis procedure has more to do with how you protect the healthcare worker. And that's sort of the main area of interest. How do you perform dialysis safely in the biocontainment unit with the limitations of the biocontainment unit, meaning that you want to reduce blood exposures, prolong the filter life so you're not changing the cartridge a lot, and your laboratory tests are going to be limited. So we usually, when we do dialysis or continuous renal replacement therapy, we like to check a lot of labs and do it frequently. The point of care testing that's going to be available is going to limit what you can test. And so it's that kind of modification in the biocontainment room that's necessary to consider when you're planning for dialysis or doing dialysis. There's quite a bit of biomedical waste, and the disposable waste that comes in contact with blood is put in a bin in the room and then taken away and usually incinerated. The machines, the way it's been done is the machines that go in the room stay in the room and become dedicated to that patient. And when that patient's care is over, then it's disinfected. And there's CDC websites to talk about how it needs to be disinfected. All of medicine is learning about something new and learning about what is confronting you at the time. And so nephrologists have been working really hard to get smarter about this disease. And we have the example at Emory where they have tremendous experience with this disease in particular, and an excellent ICU staff that's expert in doing dialysis. So we're fortunate to have that model of success to be able to translate that to individual units as they plan for taking care of this particular disease in the setting of dialysis. I think what's really important to realize is that the Dallas case was the one that everyone was aware of, and that one happened, I would say, loudly and quietly at Emory. They also had a patient who was on mechanical ventilation and receiving dialysis in a well-prepared unit in a biocontainment facility, and none of their healthcare workers became infected and their patient survived. So really taking care of patients with Ebola virus disease rests on a prepared center with an appropriate biocontainment unit and really meticulous attention to the personal protective equipment.